Hi there, I'm Professor Drew Richardson from Canberra, Australia, and this is my poster on the increasing incidence of prolonged boarding in mental health presentations in Australasia in 2020. I'd like to thank my co-author and to note that this study was funded by the Australasian College for Emergency Medicine. There are no conflicts of interest to declare. Mental health patients awaiting inpatient admission are disproportionately likely to experience prolonged boarding, which represents both a patient care issue and an equity issue in emergency departments. This study aimed to collect Australasian incidence data in 2020 at a time when the COVID-19 pandemic was having minimal effects except in one jurisdiction, the state of Victoria. It's a binational voluntary survey of all 150 EDs accredited by the Australasian College for Emergency Medicine. Participating EDs reported data for the 7 days from 19th of October 2020. Mental health presentations were defined as those with a clinical need to see a mental health clinician whilst in the ED, and admissions were defined as those to the ward rather than to short stay units. Prolonged boarding, or access block as we call it, was defined as a total ED time of more than 8 hours for an admitted patient. 59 EDs provided full data, comprising 69,657 presentations and 15,889 admissions. 5% of these were mental health presentations. They were admitted at a slightly higher rate than other presentations, and they had a prolonged boarding rate of 47.5%, significantly higher than 28.6% for non-mental health presentations. There was no significant difference between Australia and New Zealand, but New Zealand numbers were small, with only 8 mental health prolonged boarding cases in the 4 answering hospitals. Now, 24 hospitals answered both this survey and an identical 27th of November 2017 survey. Comparing like with like showed that outside Victoria, presentations rose by 3.6%, mental health presentations by 10.3%, admissions by 10.7%, and mental health admissions by 23%. Prolonged boarding rose significantly from 32.3% to 44.4% in mental health presentations, and 25.3% to 28.9% in the others. In Victoria, there was a 26.6% decrease in presentations, but an 8% increase in mental health presentations, with a reduction in prolonged boarding in both groups. It's worth noting that we already know that Victorian emergency departments are, on average, larger than those in the rest of the country. So the difference between Victoria and the rest here is in the change, not in the absolute figures. In terms of prolonged boarding of mental health presentations, Victoria had issues in 2017, and these have certainly not been resolved in 2020. We know there's been significant political attention paid to the issue of the care of mental health patients in Australasia over the past 4 years. This study confirms that there's actually been a worsening of prolonged boarding for mental health presentations in this time. Obviously, our study has limitations. These are hospital-reported summary data. There's no clinical audit possible, and it's only a single week out of what we all know was a very unusual year. In conclusion, the study confirms that prolonged boarding is much more prevalent in mental health presentations than others. It's increased over the last 3 years in Australasia by much more than the increase in mental health presentations. The jurisdiction affected by COVID-19 saw a decrease in ED presentations, admissions and prolonged boarding, but an increase in overall mental health presentations. Thank you, and I'll take any questions.